Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, good chance if you're watching this, you or somebody you know has some issues with their ankles. And it's either affecting their sports, their ability to walk, or just due to the general activities they need to do throughout the day. So unique thing about the feet is you're walking on them all day long. That's what you need for your locomotion. There's actually 7 bones in your ankles. And if any of those become misaligned, that's when the arches start to fall. And the arches in your feet are very important. You have 3 arches. One's that are long, and then there's one across the front, and there's one across the back that run transverse to your foot. Meaning that, hey, if those arches start to fall, you're going to have later issues. Now, your feet are like shock absorbers, and if your feet are not working properly, you're not going to get the shock absorbers you need. And your ankles are very important for balance as well. So we see a lot of people that have issues with their ankles, especially misalignments, that they don't know have a good sense of balance. They can't really feel where their feet are, so they have to start looking at where their feet are to tell where they're walking. And then that affects posture later on too. So, hey, some of the things that you can tell that you have weak ankles. If you keep rolling your ankles, meaning if you keep spraining them and doing some things, that's an issue. Uneven shoe wear too. So if you start wearing your shoes out one pattern more than the other, that's a good indication. If you have shoes that look like little triangles in the back, it's probably time to get rid of the shoes because that might be what's causing your weak ankles as well. So if you're walking barefooted and your knees hurt, maybe a good indication. I've had that from time to time, and I had to get my ankles checked, especially with another chiropractor. Plantar fasciitis, you start getting really sharp pain, especially when you wake up in the morning, because that's when the inflammation's there. You'll start to have the issues with that. It could be a misalignment. We find that a lot with heels, that the heel's actually kind of turned in, and it's not allowing that ligament. It's actually working harder, and it's pulling harder, and it's really starting to tear a little bit, and the arch is starting to break down. But hey, I know your first indication to go to a podiatrist, see what's wrong with there. And by all means, you want to make sure everything's correct as well. It might send you to physical therapy to strengthen those ankles, but if your foot's misaligned, if your ankles are misaligned, you're not really doing anything for the misalignment. It may result in surgery where the ligaments need to be tightened up if these become a problem later on. But you may want to consider a chiropractor who does extremity work. Now, I'm not saying that you don't need any of these other doctors. I'm just saying, hey, if you get the alignment back and right, maybe getting a pair of orthotics may be more beneficial, and it holds it in a stable foot rather than an unstable foot where your foot's moving around properly rather than not properly and you're wearing the same orthotics. So if you do have any questions, please let me know. There is some doctors, a podiatrist I would send people to. Definitely if you need orthotics, these are a great place. I wear them too. A wonderful place that's made a world of difference in me, actually more energy, and my knees and my back don't hurt nearly as bad when I walk on this concrete, which is not really good for anybody. So, hey, if you have any questions about your ankles, foot, what chiropractic can do for that as well, and if you didn't like the idea of having surgery, maybe you should consider a chiropractor that does extremity work, especially with ankles manually. That means they grab and they'll align the foot manually to make sure that they're working correctly. It helps your balance as well and takes care of that. So, hey, take care of yourself, take care of your ankles. If you have any questions about any of these, by all means, let me know. We might be able to help. If we can't help, we'll definitely shoot you in the right direction so you can get some care that you need. Because, hey, without your ankles, you're going to stop moving. And if you're not moving, that goes the rest of your health as well. Take care, everybody. Have a wonderful day. Bye.